My name is Joyce Woo. I'm a pediatric and fetal cardiologist at Ann and Robert H. Lurie Children's Hospital of Chicago and an assistant professor of pediatrics and medical social sciences at Northwestern University Feinberg School of Medicine. The synopsis for this paper is essentially we looked at all babies born with severe congenital heart defects between 2013 and 2021 in our state, Illinois through an administrative database provided by the Illinois Department of Public Health. We looked at the relationship between the time to transfer to a cardiac surgical center. That's a hospital that has capabilities for neonatal cardiac surgery. And the outcome was the total hospitalization duration. So the time between when the baby was born to when they were discharged from a cardiac surgical center. And we wanted to see whether there was a relationship between those two factors. What we found was that compared to those newborns that were born at a cardiac surgical center, those that were transferred to a cardiac surgical center between 1 and 3 days actually had similar hospitalization durations. But those who transferred after 3 days tended to have anywhere between a 4 day longer to 30-day longer hospitalization duration, again, compared to those who were born at cardiac surgical centers. So this really brings up more questions about whether the relationship between time to transfer and hospitalization duration is causal and whether there's anything we can do to modify time to transfer, and whether that would impact total hospitalization duration. I think the short answer is that we don't know for sure because our data wasn't granular enough to really get down to the driving factors for what causes later transfer. Based off of clinical experience, some potential possibilities are the heart disease was detected too late. Um, the baby was so sick that they weren't stable enough to be transferred, that there was an existing relationship between the surgical hospital and the birth hospital, with the understanding that the birth hospital should keep the baby in their intensive care unit to make sure that they were adequate size or age before they got a cardiac surgery. The other possibility, which is a little less likely, I think, might be related to socioeconomic factors, whether insurance played a role for approval for surgery. Typically, this is less of an issue based on our clinical experience, but it's still a possibility. So we can't really figure out the mechanism based off of our data. But what I think is really important is that it's really opening a door for more research into this area of how babies with critical heart disease access care. As cardiologists and cardiac surgeons and subspecialists in these big surgical centers, we try to do our very, very best to provide the highest quality care for babies once they arrive to us. But the point of this manuscript is to really point out that there's actually a whole process of accessing these surgical hospitals, and whether it's being done equitably or efficiently requires a little bit more investigation.